Hello, I'm going to show you how to do a primary tubing initiation with an Alaris pump. So I'm going to gather all my supplies. I have the primary tubing. There's also a secondary tubing. The way I tell is there's extra loops in the bag. Primary tubing's a lot shorter, and it'll have like a hook in it. And then we have our fluids. We're pretending this is normal saline. I have my flush, my pads, and my gloves. So I do hand hygiene, talking to your patient, making sure it's the correct patient, their IVs on them, all the things that are important. I'm gonna clean their IV site, which it should be the J loop. Make sure it's there. Clean, clean, clean. Let that dry. I take my flush. This flush is to make sure their IV is still patent. So we're pretending this mannequin has an IV. As I inject the 10 mils, we're checking to make sure that, firstly, the J-loop's unlocked, and then secondly, that it is not infiltrating, you don't see any bubbles, redness, and the patient doesn't have pain. So it's looking good, everything's fine. Trash. Now onto our tubing. So, I like to get my tube out first. Trying to keep this, normally the needles will have a cover. Keep the cover on until you need to take it off. That way it just stays a little extra clean. Unravel it, make sure there's no kinks. Most new tubing unravels very nicely. This is a little used. So I'm not seeing any major kinks in the tubing, which is great. Now I hold the bag upside down. There's this little hat. You're gonna pull it and there'll be a satisfying pop if it's a new bag. So it's open. I take my cover off this spike. And this can be a little tricky. You wanna shove and twist at the same time into this little opening. If it's a newer bag, a newer needle, it might take some work. So sometimes I have to bend down a little bit, but it went in just fine. So we're in, the needle's a good distance in. Okay, so we're pinching. We put the opening around the hook. Perfect. And then since this is just a normal fluid, I like to just run it into the trash can to get the air out. If it's a medication, you do not do this. You want to save as much of that as you can. So I unclamp my tubing. I usually just grab the nearest trash can, unroll, and go until there's no more bubbles in my tubing. And there's still a few working their way out. Perfect. Okay, now that the line is primed with our normal saline, I'm going to turn our pump on, which is this side button right here. I'm going to open the channel with the lever. Make sure this white part is pushed all the way in on this kind of stretchy area. We slide into it like a cassette. Close. Sometimes you need a little extra oomph to close it. Okay? So before I forget, this has been cleaned. We attach to the patient and it is clamped. So just in case, it's still safe. We're going to click, yes, this is a new patient. And then you can enter their patient ID. For our mannequins, we don't have an ID, so I'm going to go back and click the back button. To get the channel that you want, to make sure it's flowing in the right one, you do channel select. Since this is a normal saline, I'm going to say guardrail, or basic infusion, my bad. It's going to highlight the box that you are currently in. So I want to highlight the rate, and for this example, we're going to go nice and slow, so I'm going to say 25 mils an hour. The VTBI is volume to be infused. So that's the size of the bag. So what I do is I check the bag. This is a 1,000 milliliter bag, but you can't put 1,000 in a pump. So I have gotten in the habit of doing about 15 to 20 mils less than the bag, so the pump's gonna tell me before it's actually run dry. So I'm gonna do, say, 980. And then I click start, which is this very far arrow. I ensure that it's unclamped. If that happens, it's saying occluded. I just say restart. It's gonna think about it. And then green is good. Thank you.
The ATI accepted practice and indications for IV pump priming and programming are to frequently assess the IV site and to accurately and precisely deliver fluids. ATI evidence-based practice requires the nurse to ensure that all air is removed from the IV tubing and suggests back priming secondary tubing to prevent wasted medication. Some key considerations are to verify the rate and solution, know how to use the infusion pump correctly, replace tubing for blood products every 4 hours, replace intermittent infusion tubing every 24 hours, and replace all other tubing every 96 hours. Documentation tips are to document the rate, volume, and solution.